anti-anxiety or anxiolytic medication. So here we are going to talk about the typical anti-anxiety medication like benzodiazepine and atypical anxiolytic medication. Medication name, indication, mode of action, side effect, and some key points. Anti-anxiety medication depress the central nervous system and thereby increasing the effect of GABA, GABA. GABA is a neurotransmitter. It is inhibitory amino acid and decrease the nerve excitabilities. Also, medication that increase the GABA produce a calming effect, right? Because GABA produce relaxations and may depress the limbic system as well. So benzodiazepine have an anxiety reducing or anxiolytics, sedative hypnotics effect, muscle relaxing effect, and anti-convulsant action. So benzodiazepine are contraindicated in the client with acute narrow angle glaucoma and should be used some caution in the children and our old client. Benzodiazepine interact with the other central nervous system medications, produce an additive effect. Abrupt withdrawal or benzodiazepine can be potentially life-threatening, and withdrawal should occur only under medical supervision. So, benzodiazepine, the most common drugs we use, it is alprazolam or diazepam, lorazepam, alprazolam, midazolam, or chlordiazepoxide. Let me read it. Alprazolam, chlordiazepoxide, clonazepam, clorazepate, diazepam, florazepam, lorazepam, midazolam, right? Also, triazolam. So, diazepam, lorazepam, alprazolam, midazolam, and chlordiazepoxide most commonly used. In the bottom, we can see one drug, it is called buspirone. So, buspirone is atypical anti-anxiolytics we use for anxiety. And another drug is here is called bupropion. Bupropion is a smoking sedation, or bupropion we use for smoking suggestions. So what else? What are the side and adverse effects? So most common adverse effects are daytime sedation, ataxia, dizziness, headache, blur, double vision, hypotension, tremor, amnesia, slur of speech, urinary incontinence, constipation, paradoxical central nervous system excitement, lethargy, and behavioral change. So let me recap one more time. Anti-anxiolytics or benzodiazepine, basically we use for anxiety or alcohol withdrawal. The mechanism of action increase the effect of GABA in central nervous system. The common side effect, I said sedation, respiratory depression, dementia, dependency, and withdrawal. So it is the good medication for anxiety, but it is good to use short-term only. If your patient have an overdose, we give them antidote. It's called flumazenil. So anti-anxiety or anxiolytic medication, if have acute toxicity, patient present with somnolence, confusion, diminished reflexes and coma, and flumazenil, I said antidote, right? Flumazenil is a benzodiazepine antagonist that will reverse benzodiazepine intoxication in 5 minutes. The client being treated for an overdose of a benzodiazepine may experience hesitation, restlessness, discomfort, and anxiety. So what are the interventions? Monitor for motor responses such as hesitation, tension. Monitor for autonomic responses such as cold, clammy hands, and sweating. Monitor for paradoxical central nervous system excitement during early therapy, particularly in older and debilitated individuals. Monitor for visual disturbance because the medication can cause glaucoma. Monitor for liver and renal function test result and also complete blood cell count. Also reduce medication dose as prescribed for older adult client and for the client with impaired liver function. What else? Initiate the safety precursor because the old adult client is at the risk for feeling or for falling when taking medication for sleep or anxiety. Assist with ambulation with drowsiness or lightheadedness. Inform the client that drowsiness usually disappears during continued therapy. Inform the client to avoid talks that is require alertness until response to medication is established. Inform the client to avoid alcohol. Reinforce instruction to not take other medication withdraw. Continue the healthcare provider. Reinforce instruction not to stop medication abruptly, right? Can result in the seizure activities. Here, anti-anxiety or anxiolytic medication withdraw. So I said it is a good medication for anxiety, but it is good to use for short-term use only. Because long-term use develop dependency. So when time comes to stop, when withdraw, to withdraw symptom need to monitor. Dose of benzodiazepine should be dropped gradually over 2 to 6 weeks. Abrupt or too rapid withdrawal result in following. restlessness, irritability, insomnia, hand tremor, abdominal or muscle cramp, sweating, vomiting, and seizure.